So for patients who come with whitening, is it a big event coming up, or is it them being more demanding in terms of their aesthetic requirements with themselves? For whitening procedures, it is very important to know why is the teeth discolored in the first place. Is it because of diet? Is it because the teeth are intrinsically discolored, or is it other factors that will cause such things to happen? For most patients, I would recommend for them to get their teeth cleaned first before they embark on any whitening procedures, because actually when the teeth are much cleaner, the teeth will look much better in the first place. So sometimes they do not really need whitening, but they would rather have their teeth cleaned first before they are being assessed for further treatment required. Whitening treatment is generally rather comfortable as long as it's done under a controlled setting. So for the systems that we use, typically in-office whitening would require some form of light activation. Other forms like chemically activated whitening systems can be done as well, but most of them, if the concentration of the chemical is high enough, would require to be done under a supervised setting. The whitening effects will typically last for a range of period of time depending on why did the teeth get discolored in the first place. For example, if the patient is a very heavy coffee drinker, whitening effects may not be lasting. Whereas if the patients themselves can also help in the process by, for example, rinsing after their coffee and tea, or having good oral hygiene practices, that will help to prolong their whitening duration, and then that will, in the end, give them a wider smile for a longer period of time. So on average, it will typically last for a couple of months, sometimes up to a year or so, but it really depends on the patient habits themselves. For the time period for whitening wise, I would think that as they do the first whitening process, the next review which I would have with them typically is a few weeks after, just to see how they cope with the sensitivity. And then most patients would then see me back regularly for their 6-monthly scaling and polishing. During the regular assessment during the scaling and polishing, if they feel that the shape rebounds, then we would advise for further intervention. Otherwise, typically if their shape is relatively stable and they do not feel the need to intervene, then they would not require further intervention.